Pickwick Syndrome, also known as Pickwickian syndrome or obesity hypoventilation syndrome, is a rare disorder that is characterized by chronic sleepiness and obesity. The cause of the disorder is unknown, but it is believed to be caused by a combination of genetic and environmental factors. Pickwick Syndrome is named after the main character in Charles Dickens' novel, The Pickwick Papers. What are the symptoms of Pickwick Syndrome? Pickwickian syndrome is a rare disorder that causes extreme obesity and low blood oxygen levels. Symptoms include shortness of breath, excessive daytime sleepiness, and a rapid heartbeat. Pickwickian syndrome is usually caused by obstructive sleep apnea, a condition in which the airway becomes blocked during sleep. What causes Pickwick syndrome? Obesity is the main cause of Pickwick syndrome, but there are other factors that can contribute to it, including age, genetics, and medications. Obesity is the major risk factor. Other factors can also play a role, including smoking, alcohol use, and poor sleep habits. What is the pathophysiology of Pickwickian syndrome? Pickwick syndrome is associated with reduced breathing during sleep. This can lead to a buildup of carbon dioxide in the blood, which can cause serious health problems. The pathophysiology of Pickwick syndrome is not completely understood, but it is thought that a combination of factors may play a role, including excess weight, narrowed airways, and abnormalities in the way the body uses oxygen. How is Pickwick syndrome diagnosed? The diagnosis of Pickwick syndrome is a clinical one, based on the presence of obesity and evidence of abnormal breathing patterns. There is no single test that can confirm the diagnosis, but various measures can be used to assess breathing abnormalities, including spirometry, pulse oximetry, and sleep studies. People with Pickwick syndrome may have difficulty breathing when they are active or when they try to exhale deeply. They may also have a rapid heartbeat, known as tachycardia, and a low blood oxygen level, known as hypoxemia. Diagnosis is confirmed if these abnormalities are present during a sleep study. But what is the difference between Pickwickian syndrome and obstructive sleep apnea? Pickwickian syndrome and obstructive sleep apnea, known as OSA, are two conditions that are often confused with one another. However, there are several key differences between the two. Pickwickian syndrome is a rare disorder that is caused by obesity. People who have Pickwickian syndrome experience extreme tiredness and sleepiness during the day, even after getting plenty of sleep at night. OSA, on the other hand, is a common condition that occurs when the airway becomes blocked during sleep. This can lead to interrupted breathing and poor quality sleep. What is the life expectancy of people with Pickwickian syndrome? Pickwickian syndrome is a life-threatening medical condition mostly caused by obesity and associated with difficulty breathing, even when resting. They often require continuous positive airway pressure, known as CPAP, therapy to sleep. The long-term outlook for people with Pickwickian syndrome is poor, and most die prematurely from respiratory failure if they do not lose weight. How is Pickwickian syndrome treated? Pickwickian syndrome is a condition that arises when someone is obese and has difficulty breathing. Left untreated, Pickwickian syndrome can lead to health problems such as heart disease, stroke, and even death. However, there are treatments available for Pickwickian syndrome that can help improve symptoms and reduce the risk of complications. One common treatment for Pickwickian syndrome is weight loss. Losing weight can help make it easier to breathe and can improve other health problems associated with obesity. Another treatment option is supplemental oxygen therapy. This involves using a device called a concentrator to deliver extra oxygen to the lungs. This can help improve breathing in people with Pickwickian syndrome. Finally, some people with Pickwickian syndrome may need to use a mechanical ventilator to help them breathe. In conclusion, Pickwick syndrome is a serious disease that can cause death if not treated. It is important for people to be aware of the symptoms and to seek medical attention if they experience them. There is no cure for Pickwick syndrome, but treatment can help control the symptoms and improve the patient's quality of life. If you or someone you know is suffering from the symptoms of Pickwick syndrome, please seek medical help immediately. If you enjoyed the video, please subscribe, like, and share for more videos like this.